Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to our fifth episode of our Summit series. Today we're talking to friend, colleague, mentor of mine, Karen Cheeseman, the Chief Executive Officer of Mackinac Straits, which is a beautiful community. In fact, one of the most famous spots for Mackinac Island. So if you've ever had Mackinac Island fudge, then it's probably been viewed by Karen Cheeseman at some level. I don't think she's making it, but, she does get to see it be made at times. That is a community in which she has a health center. We'll talk to her more about that. But Karen, we have an audience today that may not know much about you. Why don't you talk about yourself, your role, and then a little bit about Mackinac Straits?
Well, thanks for having me this afternoon, JJ. A pleasure to be here with you. A little bit about myself. Again, my name is Karen Cheeseman. I'm the president and CEO at the Mackinac Straits Health System. We are a critical access hospital located in the eastern Upper Peninsula. We're the first community as you cross the bridge and enter the beautiful Upper Peninsula. We are a critical access hospital. We have a number of different services that we provide throughout the Straits area. And I think we'll get into that here
we
a
will.
Little further into the discussion.
Yeah, but for a community access hospital, a critical access hospital, you're functioning as a full continuum of care hospital practically. We'll get into that in just a minute. But, it's great to have you again on the podcast. You've been here before. But, what we want to talk a little bit about today is, what has happened in your organization in the last year that you're most proud of? And could you highlight something for our listeners? Just, what have you centered yourself around? What's most exciting?
This past year has been a tremendous year of growth for the Mackinac Straits Health System, something we are really proud of, and we've grown in many different service lines. And most notable was the fact that our growth reached the point that we needed to add space to best serve our community. And so I'm really proud of the team and the work that has been done over the last 2 years to plan and complete a construction project of a new professional medical office building on our campus here in St. Ignace.
Now, Karen, that did not come easy because you have lobbied your leaders in Lansing, and you really, understand this, to get an earmark is very difficult. They call it a grant now, but to get one that's directed by the state is very difficult. So you presented yourself in such a manner that you convinced them, and that's amazing because you are in an area that is underserved, right? And could you talk a little bit more about what this center is going to bring to your community?
Yeah, absolutely. So as you mentioned, JJ, we were really fortunate to secure this funding and speak to our legislators about the critical importance of access to care in northern Michigan and some of the unique challenges that we face here in our location. We serve two islands, which is presents some unique challenges in rural health.
What's the other island outside of Mackinac?
The second island is Bois Blanc Island.
Bois Blanc?
Bois Blanc.
And is it as progressive as Mackinac in terms of electricity and those things?
It is it's a smaller island.
Okay.
It sure is, but it has very similar trends that we see seasonally with an influx of residents throughout the summer months. Now, much smaller scale than Mackinac, but important that we continue to support the island and the care delivery that's needed at that location.
You're doing a great job, Karen. Very proud of the work that you've engaged in over the last year, and very excited to see, the growth that you have been able to lead at Mackinac Straits. It's great to see. Let's transition a little bit. Those are the great things, but we do have some challenges ahead of us. Right now, across this country, I would say healthcare is in what is called a crisis mode. There's a lot of challenges, and you certainly know what those challenges are. You serve on the Michigan Hospital Association board. We serve together. You're part of other committees and organizations as well. But look at it from your lens of your organization. First of all, I think that the significant challenge for us right now is we're facing this Medicaid, which it's basically a gutting is what I call it. I don't think we have to mix words. Medicaid gutting, and I think it's an opportunity for us to advocate against this. But has your organization, and I know you have, what have you done to prepare yourself to weather the storm and to find ways to be successful in this unprecedented time?
No question, we have significant challenges ahead, and we've got to be, as we've spoken many times, JJ, throughout the work that we do in rural health, we've got to be realists about what's coming. And so it's a variety of things that healthcare leaders, particularly rural healthcare leaders in underserved areas, have to be looking at. Mm-hmm. And so I think it's important that we recognize, right, it's not just one or two things. And in the few moments that I have with you today, if I were to highlight a few of those, mm-hmm. right, I think number one, we look at how we change and adapt our care delivery models moving forward. I think that we look at things differently. What we are doing today mm-hmm. with all of the constraints we're facing will not allow us to deliver care the same way into the future.
It's not possible.
Right? It's just not, whether that's 3 years, 5 years, 10 years. Yeah. And so I think we have to look at how we leverage our partnerships, how we continue to collaborate with our various partners. Mm-hmm. I think we look at industry cross collaboration, if you will, and how we really develop and strengthen our relationships. I think we have to be very focused on the shift to value-based care.
It's true.
And things that we will face in that arena with our payers that will demand mm-hmm. additional value. Mm-hmm. I think we have to be incredibly diligent at looking at how we leverage technology. I think that that comes in a number of different ways. I think it comes to us with many, many changes in artificial intelligence in the care delivery.
Yeah, AI is something we're hearing at every conference, Karen.
Right? I think as we look at the constraints of workforce and mm-hmm. we look at the models and forecasts for continued retirements mm-hmm. amongst our medical staff, mm-hmm. amongst our nursing teams, our technicians, et cetera, we know that we're going to face unprecedented numbers of folks retiring from the healthcare field mm-hmm. and or leaving the industry for something. Altogether. Yeah. And so we have to look at how we accommodate a workforce that serves our populations mm-hmm. amongst all of these different constraints.
Yeah, beautifully put. It's not just one single issue, is it, Karen?
No.
These are interwoven together, and we certainly find that one issue impacts the other issue. And as these weave together, we're faced with going to our boards and going to our community to explain this. I think if there's anything we could do on this national podcast is to lift our voices, but encourage our listeners to lift their voices. I think that is so important. You've done a great job at that. You've kept your representatives informed, and I know you've knocked on a lot of doors, but we have got to get that into the minds and the hands and the voice of every American person. It's interesting. We heard a report today, Karen, that 85% of the voters in America do not want deep cuts to Medicaid, and the American people are speaking up, and they're not happy about what this means, because cutting care and cutting Medicaid is cutting care for everybody. Would you agree with that?
I would fully agree, right? And these cuts are deep and they're far-reaching.
They are.
Right? On a number of different fronts. And as you mentioned, JJ, the first is cuts for all, which means limitations for our patients and our community in terms of access to care. And beyond that, we look at the economic impact to the communities we serve.
Oh, absolutely.
We know, you and I well know, and many others know, that in rural communities, we are the economic engines of our communities.
We sure are.
And we look at the impact healthcare has on the overall economics, and it's significant, right? And we've seen what other hospital closures, the impact that's had in rural communities.
Yeah.
In fact, just recently, last month, right, our partners at the state released the State Economic Impact Report. And, I know in my small rural community here in northern Michigan, the impact my hospital has, just on the Straits area alone, is a $54 million impact annually.
It's unreal.
And so I think about, right, if we reduce services, if we reduce employment, those are things that cannot be taken lightly.
You're
we
right.
play critical roles in our communities, and we've got to be looking at all angles.
And it can't just be you and I out there beating the drum. It has to be the constituents that we serve as hospital leaders. It has to be our board, it has to be our physicians, it has to be every employee of ours, but it has to be the greater community, because our congressional leaders need to hear from us. So, all right, Karen, let's talk about something more positive. What are you looking forward to in the year ahead?
Yes, in the year ahead, and I think it's, as we've spoken about in the past, AJ, I think it's important to maintain a sense of optimism, right, while we tackle these tough challenges. And so when I look ahead at the upcoming year, I look at some of the great positive things that we have on the horizon, and one is renovations for our hospital. I spoke about the growth earlier, and in order to accommodate that growth, we've got to have some additional space for our practitioners, our support staff, et cetera. So we are thrilled to be beginning that journey to renovate space, and again, looking out numerous years ahead as to how we serve the community. I also mentioned technology earlier, and we've got some great work ahead for some things we're doing to prepare for additional robotic surgery to best support our
Yeah, I heard that the other day.
surgeons.
This is incredible.
You bet.
And, the teaching institutions of today are, partnered up with folks from sectors of the robot. We won't name them, but we'll just say that they're a conglomerate organization. But, this new generation of surgeons are learning on the robot. And so when they come into rural communities like yours and mine, and we say we're the traditional cut, they're like, ooh, yeah, we didn't train that way. That's not what we want to do. And so good for you. I'm glad that you're getting the technology you need. I'm glad you're tackling AI. Not everyone's doing that yet. I'm glad that you're able to see a lot of good growth. But all of that is contingent upon our communities supporting us, lifting their voice, letting their voice be heard, so we can continue this great work that we're doing.
Absolutely. Absolutely, right? And we've got to keep moving forward, and we've got to be nimble, and we've got to, as you said, we've got to continue to raise our voices and fight for our communities and our patients and the care that's needed. So we will absolutely continue to do that in our work and our passion to serve our rural communities.
It's great to have my best friend in healthcare with me today, Karen Cheeseman. We catch up all the time and share, and that's a great relationship to have, because the challenges, even truly, among my colleagues that have 800-bed hospitals, we're facing the same things on a different scale, right?
Absolutely.
But we have to be in this together. There is such a storm passing by that we have to rely on each other, lift each other up, and just so encouraged to have you here today. I look forward to you joining us again on the podcast again very soon. And thank you to our listeners for tuning in to Rural Health Today. Stay tuned for the next week's Summit Series update with another great guest. Until next time, remember the power of rural. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan. and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.